New this morning, we're getting a look now at the findings of a new audit on the state's program to place sexually violent predators.
It was requested by State Senator Brian Jones from San Diego. CBS 8's Chris Groh is live downtown with more on what this report found here. Chris?
Yeah, good morning. And if you remember, we have covered many of these placements, both the hearings as well as the protests that have happened in the communities where these placements are initially sort of, again, proposed. And so this report, which was requested about a year ago, dives into that, as well as the partnership between the state hospital system and Liberty Healthcare, which runs the rehab and the homing program for the state. Now, there are, of course, a number of different findings, but we went ahead and highlighted some of those that really stood out. One of them dives into that partnership and talks about how the State Department of State Hospitals does not have an effective way to track and monitor Liberty Healthcare when implementing policies and procedures. There's a concern some haven't been updated, like Liberty's contraband policy, which was last updated in 2011. In terms of effectiveness, the report says that 56 people have been in the program since its start in 2003, with 4% of them re-offending. State Senator Brian Jones told our sister station Sacramento in this interview that he did that is 4% too many. The audit also took a look into the financial spending that has gone up drastically from 2018 to 2019. The state spent $6.6 million, but the program costs went up in this latest year to $11.5 million. Here's what else State Senator Brian Jones had to say about the audit.
The report also points out that the state is paying Liberty Healthcare $2,800 a month to find that housing. This program specifically, of course, the costs are going to go up because there's no oversight.
Now, the auditor said that something that they could do in order to improve the program would to move to a state-owned transitional housing program, something that states like Washington and Texas have done. But DSH, again, the Department of State Hospitals, wrote in response that they do not believe that that would help, especially in speeding up the process of placing these SVPs, because they don't feel that it is effective, but that also it would lead to more community protests. Eric and Netta?